You've seen me do it. You can't watch me do it enough. Until you go out and do 100 of your own, watching me do the procedure over and over is the best thing you could do, because you get familiar with the process, what to expect next, what you should be doing, what you shouldn't be doing, because each time I do it, I give you a little bit different information. It's not always going to be the same. You don't think about it the same. It's just not always the same. Let's watch me do another procedure, and we'll pick up with, I've got my needle in the vein. So I'm going to take my guide wire, which has 6-7 inches hanging out, and I'm going to get it in the hub. I'm going to advance it so I'm sure it's good. There it is. I can pull my needle off now, drop it back in its sheath for safety, and pop the tourniquet. So right now I've got the wire in. I'm going to get a 4x4, clean up a little. Thinking in your mind, what comes next? What comes next? It's got to be the over the wire thing, but right now I'm cleaning up a little. I'm going to make a nick. I've got the blade side up. I'm holding the wire. I'm going to come in next to the wire. So I'm touching my blade to the wire. I come in, I find where it meets the skin, and I'm going to make a little nick. Like literally, I'm going like to right there. It's the world's smallest surgery. It's 1/4 of an inch. You'll feel it go through the epithelial. It may pop a little, but that's it. You're only right next to the wire. Bloop, just like that. You might even spin the wire a little to ream it out, but you don't have to. I'm not convinced on that one. This is the introducer. Make sure that the vessel dilator is screwed in. You can see the white tip at the end, and you're gonna, with the glove hand, you're gonna get the end of the nitrile guide wire inside the tip of your vessel dilator. You're gonna slide it in, and you may have to ream it out again. You may have to push. You may have to. It may bend, kink a little bit. Don't do that. And then you may have to pull it out, or you may have to dry off your. You may have to hold it like this, but then it'll pop. Ooh, and it'll go all the way in, and you'll pull your vessel dilator out a little bit to take the tension off the vessel. You've got your guide wire hanging out. Your vessel dilator is pulled out of your introducer. There it is. Now, even though your tourniquet's off, there may still be a little bit of bleeding. So before you go any further, you may take a 4x4 and tuck it up under the introducer, because that's where some of the blood's going to come from in the procedure. So I've got it up under the introducer now. This is insertion time, and we have to deal with the hanging guide wire. So the guide wire goes back in the safety. Guide wire goes back in the safety sheath. But before you take the guide wire out all the way, because once you take the guide wire out, even though the tourniquet's off, there's still going to be some blood because you're in the vein. You want your pick, midline, whatever, you want it to be ready. And you can't be afraid of a little bit of blood in this game. So you're going to take it out, and now it's out. There's going to be a little bit of blood from the vessel dilator. You're going to pull the vessel dilator back most of the way, and you'll be ready with your insertion. You'll pull the vessel dilator out, put your insertion right in, just like that. You may have to work it with a flush at this point. And sometimes you might hit a little bifurcation that you didn't know about. So you might have to hook up a flush, and you might have to pump it a little and float it in. But this is as far as it gets. It doesn't, the notch inside the inside the vessel, the introducer, prevents it from going any further. But you know you're in because you're at like 17 already in, right? So we're going to just break the introducer. It splits open. But watch the midline back out as we push it out. So you have to stop about halfway through and make sure that your catheter is in. And then you're going to come back to it and you're going to pull it open again. But here's the thing. You're going to stop one more time. You're going to make sure your catheter's in, but you're also going to grab the introducer way lower, because when it breaks, what you don't want is this. Blah, because then you're going to get blood flicking in your face. It's just like a rope. You got to control the end of it. So you're going to pull it open, and now I've split the introducer. The vasodilator's out. I can advance my catheter and I can start to clean up. But super dangerous, because catheter is not secured. I wipe any blood off of it, detach my flush, and now we're going to start closing it up. I'm going to crack my chlorhexidine and wipe on the center, but I'm also going to wipe all around it. I'm going to lift this underneath this all around. I'm going to go over it, make sure that the clip is toward the hub and not toward the hub and not the insertion hub. There you go. And you're going to clean it off, clean the whole thing off, and you got to wait for this to dry. And now we're into the stat lock. And in the stat lock, you get the skin prep and the stat lock. I like to put the stat lock on first. Get it in. It'll say, mid or pick face up. You'll fold it over and lock it down, keeping clear of the sharp tabs with your gloves because it's a bloody procedure. And now the stat lock's on it. That's more secure for me than doing this first. Now I've got the stat lock on it. I'm going to prep the skin with the skin prep. You make sure that the flaps on your stat lock, one to each side, don't let them come over both to one side, because when you put it down, so you got to make sure one's to each side. You don't need it on the 0. You generally want it on the 1. You can do it on the 0. You don't want it on the 2. So we got it on the 1. Pull one side of the stat lock off. See, it even pushed in a little. Get the other side of my stat lock off. And now it's secure. We're not done, but it can't just fall out anymore. You'll have one of your syringes prepared with the lure lock, and now that it's in, you'll pull the wire back. Oh, I pulled it out. Don't pull the wire out all the way. Keep the wire in a little bit because it blocks the blood from flowing up the catheter tube. Pop the whole thing out. Plus, you don't want a wire whipping around. So you always want the wire just a little bit inside the tube, because that keeps it from whipping around. So we unthread it. We got the wire on the end. I can toss it up on my sterile field. It's the end of the surgery. I'm about to wrap it up. Grab my lure lock on the end of the syringe that I prepped, lock it down, flush, aspirate, make sure it's in, right? Flush the rest of this down, and then clamp it, twist off my empty flush, and here's the big deal. Clipped, twisted and locked, clipped and locked, clipped and locked. You have to go through one more time. Clip to make sure the clip is there and that you've twisted it. Clipped and locked, clipped and locked. So it's stat locked down, clipped and locked, and now I'm ready to finish buttoning it up. I wiped it down with my chlorhexidine so there's no more gel. I've got my antimicrobial patch with the split over the catheter. Remember, this goes on with the notch toward the clip first. Clip side first, lock it down, and set it down over the rest. Go around the edges one more time. I would generally do like a glove change here to make sure that the outside doesn't have any more inside gunk like blood on it. And now I'm going to start to pry it up, go around the edge, pull the paper while I'm going around the edge of the bandage to make sure it's secured. And now I've got a pigtail underneath the bandage, and on the paper, on the frame, is the chevron. So you're going to hold the chevron fingertips like that, and you get up under it, drop one side on the cloth, drop the other side on the bandage as well, and lay them down. The chevron goes on the bandage. Otherwise it gets sweaty and, you know what I mean, it comes off with the patient's skin. And now I've got bandage to bandage. Look at that. Look at that. I mean, that's pretty good. A lot of patients pull their lines out. I mean, they just get tired and sleepy. Medication, it itches them. They wake up, they don't know what it is. And it's all because of this chevron and the edges of your bandage. So now it's in. You don't need to flush it again. Clipped and locked. You already know it's clipped and locked. No loose wire. I mean, here's one wire. It's not a sharp. You know, here's the other wire. It's not a sharp. Needle is a sharp. But that's how you secure it. Finish it up. Get the wire and look at that. That's pretty good. Bandage on bandage. I got a little wrinkle right there. Patient won't complain. They'll be pretty happy. All right, that's how you do it again and again and again until you're this good at it.